Hi everybody, my name is Karin Schölin Bywall. I am a postdoc at Uppsala University. It's located in Sweden. And I will talk about patients' preferences for second-line rheumatoid arthritis treatment. And this is a study that we conducted in Sweden. So just as Karin mentioned, patients with rheumatoid arthritis are facing several different treatment alternatives, and they are different in regard to how they are being administered and the effect of the treatment, but also the side effects. So within this study, we focused on assessing preferences for second-line treatment. And when we designed this preference study, we also consider the regulatory relevance of this study, because regulators, so decision makers that assess, makes the benefit risk assessment and whether a medical product should be approved or not, they want to include patients, and they are currently doing by including them as representatives in decision boards. But what they also want is that they want to be able to include data on a more aggregated level. So preference data assessed from the patients to be able to be included in the benefit risk assessment. So that's why we focused on this in this study. We had three main aims. The first one was to assess patient preferences for second-line treatment, but we also wanted to know whether there are differences in treatment preferences. And thirdly, we wanted to know if we could estimate the minimum acceptable benefit for a given side effect. So this preference study was a discrete choice experiment. So each respondent answered to 15 choice questions, and each choice questions consisted of two different treatment alternatives, so hypothetical treatment alternatives. And within those treatment alternatives, we included 7 different attributes with 3 levels each. So the attributes that we chose for this study was mode of administration with the levels tablet, injection, or drip, frequency of use, whether it's daily, weekly, or monthly taken. And we included the side effects attribute. So the probability of getting a mild short-term side effect, such as nausea, vomiting, or headache, the probability of a side effect affecting your appearance, such as hair loss, weight gain, or skin rash, and the probability of psychological side effects, such as anxiety, mood changes, depression, or sleep disturbance. And also probability of getting a severe side effect. And that was side effects such as getting a severe infection or allergic reaction. And when we chose the levels, so you see all of these side effect attributes have the same levels, we considered the package sleevelet, so the information that patients are already familiar with, but also information that is relevant for the regulatory decision makers. So information that they would use in a benefit risk assessment. And then we also included an attribute for the effectiveness of the treatment. Yes, so I have simplified this a little bit. In the patient preference assessment, we were able to include 358 patients in Sweden, and we recruited through clinics across Sweden. We also recruited through the patient association and their social media channels. And we also recruited through a company that recruit patients for you. And what we could see here is that we could find 3 latent or hidden preference patterns within the data. So 33% of the respondents thought effectiveness was the most important attribute out of those 7 that I just showed you. And 28% considered the administration. So how it's taken, or whether it's a pill or an injectional drip, as the most important attribute. And 38% considered severe side effects as the most important attribute. Yeah, so looking a little bit deeper into the different preference patterns, or the underlying preference patterns, we saw that those thinking that effectiveness was the most important attribute would also be accepting much higher side effects or risks of side effects than the other groups. Yeah, and looking a little bit deeper into the administration group, we saw that the probability of belonging to this group increased for those newly diagnosed. And then for the severe side effects group, we saw that the probability of belonging to this group increased for those with a longer disease duration of rheumatoid arthritis and already previous experience in mild side effects, such as nausea, vomiting, and headache. So this is the bigger picture here that I wanted to show you. So it was also other things that was important here. This is the 3 latent or hidden preference pattern in the form of a relative importance. So if we look at the second group, we see that the administration was the most important, but here those answering also consider how the medicine is taken as important, but also the risk of getting a psychological side effect. And we can see, if we look at the third group, that the risk of getting a severe side effect was most important, but it was also important the risk of getting a psychological side effect. So the clinical implications from this study is that we could see here that there were differences in what patients prefer, and it's important to acknowledge that from a clinical point that patients will actually like different things. And it's also important when you talk to patients to align their treatment decisions with their needs and their preferences. And the regulatory implications from this study was that we were able to provide data, preference data on an aggregated level in a relevant form to be used in regulatory benefit risk assessment. For regulators to be able to align their decision on whether to approve a medical product or not with the patient's needs and their preferences.